focus of this videotape is going to be on infection control. Hi, I'm Kathy Getrust, and I'm an instructor in community health nursing. One of the major goals in healthcare is to prevent the spread of infection, called pathogens. Infection control is the effort that we place to prevent the spread of pathogens. There are always going to be harmful germs around us. They never can all be eliminated, but they can be reduced by maintaining certain cleanliness procedures. You will hear the terms clean and dirty being used as it relates to cleanliness procedures. Clean is considered to be a situation with equipment and supplies when they are free of pathogens. Examples might be linen that's on a linen cart, or it could be equipment or supplies that are being stored in a clean utility room. Dirty, on the other hand, is considered to be soiled with pathogens. That means that it would be any item that has been taken into a patient room. It could be linens or other supplies or a piece of equipment. Even if the item taken into the patient room has not been used for the patient, it is still considered dirty and can never be taken back out of the patient room for reuse until it has been cleaned with a disinfectant, or in the case of linen, has been laundered. There are specific guidelines for preventing the transmission of pathogens. These guidelines have been developed by the Centers for Disease Control and Prevention, more commonly called the CDC. These guidelines were developed in 1995 and consist of two tiers of prevention. The first tier of prevention is called standard precautions. Standard precautions are used when caring for all of your patients. It assumes that all patients are infectious. By adhering to standard precautions, healthcare workers are protected in all of their interactions. These standard precautions apply to situations in which a caregiver may come in contact with blood, body fluids except for sweat. This could be secretions or excretions such as urine, feces or stool, vomit, semen, or vaginal secretions. It also applies to situations in which a caregiver may come in contact with mucous membranes. Those are the moist linings of the mouth, eyes, nose, and genital area. It also applies when in contact with non-intact skin. Non-intact skin is skin that has been broken or damaged. All caregivers follow certain procedures to prevent the spread of infection. These procedures stress hand washing and the use of personal protective equipment, also just called PPE. The PPE, or personal protective equipment, consists of gloves, gown, mask, goggles, or face shield. Standard precautions for infection control stress the importance of washing hands before and after wearing gloves, when touching blood or body fluids, and always between patient interactions. Also, wearing gloves when in contact with blood, body fluids, secretions, excretions, non-intact skin, or mucous membranes. Wearing a gown with procedures that are likely to generate soiling of clothes by exposure to patients' blood or body fluids, draining wounds or other secretions or excretions. wearing a mask or eye protection with activities that are likely to generate splashes or sprays of blood or bodily fluids to the eyes, nose, or mouth. Once used, patient care equipment is considered soiled and must be cleaned in a manner that prevents contamination to the caregivers and to other patients and the environment. More specific information about standard precautions will be covered on another videotape. You will also receive extensive training in your orientation to a new facility about standard precautions. The rest of this videotape will be covering information about the second tier of precautions, called the transmission-based precautions. These transmission-based precautions are used with patients who are known or suspected to having a contagious disease. An example of a contagious disease might be tuberculosis, pneumonia, or measles. These transmission-based precautions are designed to interrupt the mode of transmission, or the way that pathogens are transferred from one person to another. Transmission-based precautions are always considered extra precautions. That means that standard precautions are always used in addition to the transmission-based